Talk about some of the potential health care impacts if there is a government shutdown. We have Senator David Hann. Thanks for joining us.
Good to be here.
First of all, as chair of the Health and Human Services Committee for the Senate, let's begin with the bill that was passed and not signed by the governor. What are some of the reforms that you supported, and are there any that you think could make it into a final global agreement with the governor?
Well, we did have a number of, I think, fairly significant reforms that we were trying to get at, and I would hope that as we go down this path of negotiation that some of them will end up in some form. It's hard to usually get your entire array of reforms passed when you have a governor of the other side of the aisle, so to speak, but we think that there are some elements in there that we think there should be agreement on. One of them is we have looked at reforming the low-income health insurance structure currently under Minnesota Care. This is a insurance program that requires people to pay a premium, and they have a sort of a adjusted premium rate depending on income and so forth, and it's designed for people that are working but may not have a high enough income to support a full policy. And what we're doing is offering them an opportunity to receive a grant, a direct grant from the government to go out in the private marketplace and purchase their own health insurance. And we think for a number of reasons that makes a lot of sense. It does save a lot of money, significant money. And I think that originally in the Senate bill we had a very, very broad approach to that. We narrowed that down a little bit in conference with the House, and I would hope that at some point when we reach agreement with the governor that there will be some version of that available to the people of Minnesota. It does represent cost savings, but it also reinforces the idea that private markets play a critical role in health reform, and you need to have the incentives of people involved in making decisions about health care, and even low-income people have the opportunity to do that. So that is one of the major reforms. Probably the other large reform that we have in the bill is associated with a restructuring or a reinvigoration maybe of the CCDS structure that Governor Plenty and the legislature agreed to a few years ago as a reform to the General Assistance Medical Care Program that was costs were rising so rapidly we couldn't possibly keep up with it. And what this is essentially is it's a budgeted amount that is distributed to hospitals that is used by them to make decisions about how to care for the very, very low income portion of the population that needs assistance. And we've put additional resources into that, and we're also looking at changes in policy that would make that program more broadly available across the state. And in response to some of the feedback we got from the hospitals that participated, we think there are some very good reform elements in that idea as well. So we hope both of those ideas in some form would survive.
And we'll talk a little bit about the negotiations in just a moment, but first I want to shift gears to a potential shutdown. It's looking probable at this point, according to many. And so let's discuss, first of all, what this means for healthcare and different programs and services that are offered through the state.
Well, I guess it depends on who you talk to. We just were in a meeting where we were talking with Commissioner Showalter about the governor's response to the Attorney General's petition to the court in the event of a shutdown. And of course, when it goes to the court, what it gets to is a discussion of what is considered essential services. The governor's response is arguing for a very, very narrow view of essential services, in effect saying that things like health care for medical assistance and so forth ought to be continued, however, that the funding for it wouldn't continue. So I'm not sure if I quite have figured out how that works yet, but that was kind of, in the governor's view, the way this would work is that those services would continue, they just wouldn't be paid for. And I'm thinking that that may work for a few days, but at some point people who are doing work are going to eventually want to see reimbursement for their efforts, so I'm not sure how that works. So there could be impacts to people in the event of a shutdown. I think we went through this earlier in 2005. In that particular case, of course, those activities were funded as a part of a continuing activity of government. I think that if you do go to a shutdown, they ought to be continued as part of what we normally would do. But I want to again reinforce the point that we've been making, that there is no need to have a shutdown. I know we haven't reached agreement on all the budget with the governor, but it would seem to me that it would be preferable to have some sort of for want of a better term, lights-on legislation that would be adopted by the legislature to allow the continuation of the current budget structure. And we could certainly do that in the course of a day if the governor called us back. And I think that would, in my opinion, be preferable than to go to a shutdown.
According to Human Services Commissioner Lucinda Jessen, there were more than 500,000 letters going out to folks who are served through various programs. And they were notified that those who receive health care benefits, food support, adoption services, and other critical assistance may not be able to access those benefits and services come July 1st. The specifics were not given, but are those, in your opinion, critical services?
Well, I think that, again, it depends on who you talk to. I think whoever you talk to, you're going to get a different opinion. You could go very narrowly and say the critical services are the things that the Constitution of the state of Minnesota specifies. Of course, healthcare is not included in that at all. You could look at a more expansive vision of that and say, well, critical services are anything that has to do with things that might lead to medical necessity or endangerment of people, and that would probably encompass a whole host of things like bridge inspections and payments to medical care, nursing homes, and so forth. So I don't know that there is a precise definition of it. I think as a constitutional question, it is certainly troubling to have the courts be in a position of making determinations that are the jurisdiction of the legislature. But again, I think from our perspective in the legislature, there are better solutions than relying on the courts to do this. And again, the simplest way to do it, if you don't have an agreement, is to pass an agreement that would allow the continuation of the current budget structure, so that everything that is going on right now would continue to go on until such time as a final agreement on the next year's budget would be reached. And I think that would be preferable.
And Senator, as you mentioned earlier, the GOP contends that a shutdown is not necessary, and they're holding tight to that. However, in the event that it's looking more probable, in your opinion, is a shutdown a better option than moving on the $34 billion budget target?
Well, I think when you say moving on the $34 billion budget target,
new revenue.
New revenue. Well, and of course we would say that our budget does incorporate a lot of new revenue. It incorporates, from the perspective of the Minnesota taxpayer, almost $4 billion in new revenue compared to the current level of spending. If you add in the one-time federal monies, it's about the same, maybe a little bit more than with the current level. And in areas like health and human services, our budget calls for $800 million in additional revenue from current levels of spending. So we would argue that we do have additional revenues in our budget. We think it is a balanced budget. What it doesn't do is it doesn't impose new taxes on income earners in the state of Minnesota. And that, we think, is very problematic. We are in the midst of a recession. People are now talking about a double-dip recession. And to look at the people that are the job creators and the people that are in a position to create opportunities to work for people of Minnesota, and to tell those people that they're going to be compelled to pay additional amounts of money to finance the state, that is not going to help the economy. And it's particularly troubling when you look at that group of individuals and look at the amount of money they currently bring into the state. In income taxes alone, about the top 2% of our income earners pay about 30% of the total income taxes that we collect. Now, I would say that's certainly fair, at least. And to add an additional burden to those people is not going to help the economy, and that's why we've been very firm about not going that route.
So, yeah, so it's fair to say that you don't want to spend more than what's in the checkbook.
That's correct.
Okay. Senator David Hann, thanks for your perspective today. Greatly appreciated.
You bet.